Hi there viewers, welcome back to Remedy 24. Today we gonna learn about 15 vitamin C deficiency signs and symptoms. Vitamin C is a necessary nutrient that should be eaten regularly to avoid insufficiency. Although the deficiency is uncommon in industrialized nations due to the abundance of fresh produce and the addition of vitamin C to specific diets and supplements, it nevertheless affects about 7% of people in the United States. Poor nutrition, alcoholism, anorexia, severe mental illness, smoking, and dialysis are the most frequent risk factors for vitamin C insufficiency. While severe vitamin C deficiency symptoms might take months to manifest, there are some subtle indicators to look for. The 15 most frequent signs and symptoms of vitamin C insufficiency are listed below. 1. Skin that is rough and bumpy. Vitamin C is essential for the formation of collagen, a protein found in connective tissues such as skin, hair, joints, bones, and blood vessels. Keratosis pilaris is a skin disease that can occur when vitamin C levels are insufficient. Due to an accumulation of keratin protein inside the pores, a lump develops on the backs of the upper arms, thighs, or buttocks. Vitamin C insufficiency causes keratosis pilaris, which usually develops after 3 to 5 months of insufficient consumption and disappears with treatment. However, because keratosis pilaris can be caused by a variety of things, its existence alone isn't enough to rule out a deficit. 2. Body hair in the shape of a corkscrew. Due to abnormalities that occur in the protein structure of hair as it develops, vitamin C deficiency can also cause hair to grow in a bent or coiled form. Corkscrew-shaped hair is one of the most common symptoms of vitamin C insufficiency, although it isn't always visible since damaged hair is more prone to break off or fall out. Hair abnormalities often resolve within 1 month of treatment with adequate amounts of vitamin C3. Hair follicles with a bright red color. On the surface of the skin, hair follicles contain several small blood arteries that feed the region with blood and nutrients. These little blood vessels become brittle and burst easily when the body is low in vitamin C, causing small, bright red patches to develop around the hair follicles. Perifollicular bleeding is a well-recognized symptom of severe vitamin C insufficiency. Taking vitamin C pills for 2 weeks usually cures this problem. 4. Red spots, or lines on spoon-shaped fingernails. Spoon-shaped nails have a concave form and are typically thin and brittle. They're most often connected to anemia caused by iron deficiency, but they've also been linked to vitamin C insufficiency. Splinter hemorrhage, or red patches, or vertical lines in the nail bed, can occur as a result of weaker blood vessels that readily burst during vitamin C deficiency. While the look of fingernails and toenails can assist identify the possibility of vitamin C insufficiency, it should be noted that this is not a diagnostic test. 5. Dry, damaged skin. Vitamin C is abundant in healthy skin, particularly in the epidermis, or outer layer of skin. Vitamin C maintains skin healthy by preventing oxidative damage caused by the sun and pollution, such as cigarette smoke and ozone. It also encourages the synthesis of collagen, which keeps the skin appearing lush and youthful. Vitamin C consumption is linked to enhanced skin quality, whereas low intake is linked to a 10% higher chance of having dry, wrinkled skin. While vitamin C insufficiency can produce dry, damaged skin, it can also be caused by a variety of other reasons, thus this symptom alone is not adequate to identify a deficit. 6. Easy bruising. When blood vessels under the skin burst, blood leaks into the surrounding regions, producing bruising. Because inadequate collagen synthesis creates weak blood vessels, easy bruising is a typical symptom of vitamin C insufficiency. Bruises caused by deficiency might cover vast regions of the body or look like tiny purple spots beneath the skin. One of the first noticeable indications of a deficit is easy bruising, which should prompt additional research into vitamin C levels. 7. Wounds that are slowly healing. Wounds heal more slowly when vitamin C deficiency decreases the rate of collagen production. People with chronic, non-healing leg ulcers are much more likely to be vitamin C deficient than individuals without chronic leg ulcers, according to research. Old wounds may reopen in extreme cases of vitamin C deficiency, increasing the risk of infection. Slow wound healing is one of the most advanced symptoms of deficiency, and it is usually not seen until after a person has been deficient for a long time. 8. Swollen and painful joints. Vitamin C insufficiency can damage joints since they contain a lot of collagen-rich connective tissue. Many cases of joint discomfort linked to vitamin C insufficiency have been documented. frequently severe enough to cause limping or trouble walking. In those who are low in vitamin C, bleeding inside the joints can occur, producing swelling and extra discomfort. Both of these symptoms, however, are treatable with vitamin C tablets and usually go away within a week. 9. Weak bones. Vitamin C deficiency can harm bone health. Low intake has actually been related to a higher risk of fracture and osteoporosis. Vitamin C has an important part in bone production, according to research, thus a shortage can hasten bone loss. Vitamin C deficiency may have a greater impact on a children's bones since they are still growing and developing. 10. Gum bleeding and tooth loss. Gums that are red, swollen, and bleeding are another symptom of vitamin C insufficiency. Gum tissue becomes weaker and inflammatory without enough vitamin C, and blood vessels bleed more easily. Gums may appear purple and rotting in severe stages of vitamin C insufficiency. Teeth can eventually fall out if the gums are diseased and the dentin, the calcified inner layer of the tooth, is weak. 11. Poor immunity. Vitamin C accumulates inside several types of immune cells, according to studies, to aid in the fight against infection and the destruction of disease-causing microorganisms. Vitamin C insufficiency is linked to weakened immunity and an increased risk of infection, particularly severe infections like pneumonia. In fact, many patients with scurvy, a condition characterized by a lack of vitamin C, die of infection as a result of their weakened immune systems. 12. Persistent iron deficiency anemia. Vitamin C insufficiency and iron deficiency anemia frequently coexist. Paleness, tiredness, difficulty breathing during exertion, dry skin and hair, headache, and spoon-shaped fingernails are all symptoms of iron deficiency anemia. Vitamin C deficiency anemia can be caused by a reduction in iron absorption from plant-based diets, as well as a disruption in iron metabolism. Excessive bleeding, which can contribute to anemia, is also a danger of vitamin C deficiency. If you have iron deficiency anemia for a long time with no clear explanation, you should get your vitamin C levels checked. 13. Fatigue and a bad mood. Fatigue and a bad mood are two of the first indications of vitamin C insufficiency. These signs and symptoms may occur before a full-blown deficit has developed. While tiredness and irritability are common early symptoms, they usually subside after a few days of sufficient consumption or within 24 hours of high-dose supplementation. 14. Unexplained weight gain. Vitamin C may help protect against obesity by controlling fat cell release, lowering stress hormones, and reducing inflammation. There is a continuous association between poor vitamin C intake and increased body fat, although it is unclear if this is a cause and effect relationship. Surprisingly, low blood levels of vitamin C have been related to greater levels of belly fat in people of normal weight. While extra body fat alone does not indicate a vitamin C deficiency, it is worth investigating once all other causes have been checked out. 15. Chronic inflammation and oxidative stress. One of the most essential water-soluble antioxidants in the body is vitamin C. It protects cells by neutralizing free radicals that cause oxidative stress and inflammation in the body. Because oxidative stress and inflammation have been related to a variety of chronic diseases, including heart disease and diabetes, lowering levels is likely to be helpful. Vitamin C deficiency has been related to increased inflammation and oxidative stress, as well as an increased risk of heart disease. One study discovered that people with the lowest blood levels of vitamin C were approximately 40% more likely to have heart failure within 15 years than those with the highest blood levels, despite not being vitamin C deficient.